Welcome to our comprehensive guide on feline birthing. The process of a cat giving birth is called parturition in medical terms, or more commonly known as queening. Understanding the signs of pregnancy is the first step in preparing for birth. Pregnant cats show physical changes including enlarged nipples, a rounded belly, and behavioral changes like seeking quiet nesting spots. The average gestation period is 64 to 67 days, with most cats delivering 3 to 5 kittens. Creating the right birthing environment is crucial for a successful delivery. The mother cat needs a quiet, warm, and secure location with clean bedding. The nesting box should be appropriately sized and positioned away from household traffic to reduce stress during labor. The birthing process consists of 3 distinct stages. Stage 1 is early labor, lasting 2 to 12 hours, where contractions begin and the cervix dilates. Stage 2 is active labor, where kittens are delivered over 30 minutes to 6 hours. Stage 3 involves the delivery of placentas within 15 minutes of each kitten. Modern veterinary medicine has significantly improved birthing outcomes for cats. Telemedicine allows real-time monitoring, wearable devices can predict labor onset, and advanced neonatal care has increased kitten survival rates to 85 to 95%. With proper veterinary support, maternal mortality is now less than 1% in healthy cats. Throughout this educational series, we'll cover pre-birth preparation, the detailed stages of labor, immediate post-birth care, and most importantly, when to seek veterinary help. Understanding the difference between normal birthing processes and emergency situations is crucial for ensuring the health and safety of both mother and kittens. The nesting phase is a critical preparation period that begins 24 to 48 hours before your cat goes into labor. During this time, your pregnant cat will exhibit specific behavioral and physical changes that signal the approaching birth. Your cat will display several behavioral changes during the nesting phase. She may become restless and pace around the house, actively seeking quiet and secluded spaces where she feels safe. You'll also notice a decreased appetite as her body prepares for labor. Here we see a cat demonstrating the seeking behavior, finding a quiet, enclosed space under blankets where she feels secure and protected. One of the most reliable physical signs is a drop in body temperature. Your cat's normal temperature of around 102 degrees Fahrenheit will drop to 99 degrees or below, signaling that labor will begin within 24 hours. You'll also notice significant mammary gland enlargement as the cat's body prepares for nursing. The nipples become more prominent and the surrounding tissue swells in preparation for milk production. Providing a proper nesting box is essential for a successful birth. The box should be approximately 1.5 times your cat's length, with low sides for easy access. Use washable materials and place it in a quiet, warm location away from household traffic. Remember that cats instinctively seek enclosed, comfortable spaces for giving birth, as shown by this cat creating a natural nest. Your provided nesting box should mimic these natural preferences. Modern technology has revolutionized prenatal care for cats. Since 2023, there has been a 40% increase in virtual veterinary consultations. Telemedicine allows you to receive real-time guidance during the nesting phase, monitor your cat's condition remotely, and get immediate expert advice without the stress of traveling to a clinic. The nesting phase is your opportunity to ensure everything is ready for a successful birth. By recognizing the signs, providing proper preparation, and utilizing modern veterinary support, you can help ensure the best possible outcome for both mother and kittens. Stage 1 of feline labor is called early labor, and it can last anywhere from 2 to 12 hours. This is the longest phase of the birthing process, during which important internal changes prepare the mother cat for delivery. During early labor, 2 critical physical processes begin. First, uterine contractions start. These are rhythmic muscle contractions that help push the kittens toward the birth canal. Second, the cervix begins to dilate. This is the opening of the birth canal that must expand to allow the kittens to pass through during delivery. During early labor, you'll notice several behavioral changes in your cat. She may begin panting as her body works through the contractions. You might see her pacing restlessly around the house, and she may vocalize more than usual with meowing or other sounds. An important sign that early labor has begun is that your cat's body temperature returns to normal. During the final days of pregnancy, her temperature typically drops, but as labor starts, it returns to the normal range of 98 to 102 degrees Fahrenheit. It's crucial to provide a calm and quiet environment during early labor. This means ensuring your cat has a quiet space with dim lighting and minimal disturbances from people or other pets. Recent research has shown that maintaining a calm environment can actually shorten labor time by an average of 2.5 hours. This reduction in stress benefits both the mother cat and her kittens. Remember, early labor is the longest stage of the birthing process. Watch for the behavioral signs, ensure your cat's environment is calm and quiet, and allow nature to take its course during this important preparatory phase. Stage 2 is the active labor phase when kittens are actually born. This is the most critical and observable part of the birthing process. Between each kitten birth, expect anywhere from 30 minutes to 6 hours. This wide range is completely normal, as each mother cat progresses at her own pace. Let's examine what happens during the actual delivery process. This anatomical diagram shows how kittens are positioned in the uterus and birth canal. Kittens can be born in two different presentations. 60% are born head first, which is the most common presentation. The remaining 40% are born breech, meaning the rear end comes out first. Both presentations are completely normal. Each kitten emerges enclosed in an amniotic sac, a protective membrane filled with fluid. This is completely normal and protects the kitten during birth. The mother cat has powerful instincts that guide her through the delivery process. She will immediately break open the amniotic sac, clean the kitten, and sever the umbilical cord. Here we can see a mother cat demonstrating these natural behaviors with her newborn kittens. Notice how she gently but thoroughly cleanses each kitten. While most births proceed normally, it's important to know when intervention may be needed. If more than 2 hours pass between kittens, this could indicate a problem requiring veterinary assistance. Remember, most cats give birth naturally without any problems. Understanding the normal process helps you recognize when everything is going well and when professional help might be needed. Stage 3 of feline birth focuses on placental delivery, a critical phase that occurs after each kitten is born. Understanding this process is essential for monitoring the health of both mother and newborns. After each kitten is delivered, the placenta must be expelled within 15 minutes. This timeline is crucial for preventing complications and ensuring the mother's health. The placenta is the organ that provided nutrients and oxygen to the developing kitten. Each kitten has its own placenta that must be delivered separately. The placenta appears as a dark, fleshy mass connected to the kitten by the umbilical cord. It is completely normal and beneficial for the mother cat to consume the placentas after delivery. This behavior provides important nutrients and hormones that help with recovery and milk production. Do not be alarmed if you observe this natural instinct. The most critical aspect of stage 3 is counting the placentas. There must be exactly one placenta delivered for each kitten born. This 1-to-1 ratio is essential for ensuring no placental tissue is retained in the mother. A retained placenta is a serious medical emergency. If any placenta is not delivered within 15 minutes, or if the count does not match the number of kittens, immediate veterinary intervention is required. Retained placental tissue can cause severe infection, fever, and life-threatening complications for the mother cat. Remember, stage 3 requires careful monitoring and counting. 1 placenta per kitten, delivered within 15 minutes each. When in doubt, contact your veterinarian immediately for guidance. The first moments after kittens are born are absolutely critical for their survival. Proper immediate care can significantly increase survival rates and ensure healthy development. In the first 15 minutes after birth, the most important priority is ensuring each kitten is breathing properly. Newborn kittens are born in an amniotic sac that must be removed. The umbilical cord requires proper attention. The mother cat will typically bite through the cord herself, but it's important to ensure it's handled correctly to prevent infection. Within the first hour, kittens should attempt to nurse. This first milk, called colostrum, contains essential antibodies that protect kittens from disease and is crucial for their immune system development. Temperature regulation is absolutely critical for newborn kittens. Maintaining their body temperature between 96 and 100 degrees Fahrenheit in the first week increases survival rates by 15%. Monitoring weight and feeding patterns is essential in the first 24 hours. Regular weight checks help ensure kittens are getting adequate nutrition and developing properly. Remember, proper immediate post-birth care dramatically improves kitten survival rates. The first 24 hours are the most critical period, and close monitoring during this time sets the foundation for healthy development. While most cat births proceed normally without complications, there are specific warning signs that indicate the need for immediate veterinary intervention. Recognizing these signs can be the difference between life and death for both mother and kittens. The first category of warning signs is time-based. If a cat is actively straining for more than 30 minutes without delivering a kitten, this indicates a serious problem requiring immediate veterinary attention. Similarly, if more than 2 hours pass between kitten deliveries, this suggests complications that need professional intervention. These time limits are critical guidelines that should never be ignored. Physical warning signs are equally important to recognize. Green discharge appearing before the first kitten is born indicates a serious emergency, often signaling placental separation or infection. Additionally, signs of maternal distress, such as excessive panting, weakness, continuous crying, or trembling, indicate that the mother cat is in serious trouble and needs immediate professional care. Certain cat breeds face higher risks during birth. Persian cats and other flat-faced breeds often have large kittens relative to their birth canal size, making natural delivery difficult or impossible. These breeds frequently require cesarean sections to safely deliver their kittens. If you own a Persian or similar breed, discuss delivery plans with your veterinarian well before the due date. When any of these emergency signs appear, immediate action is required. Contact your veterinarian right away and prepare for transport to the clinic. Keep the mother cat calm, but do not attempt to assist with the delivery yourself. Remember, time is absolutely critical in these emergency situations. Having your veterinarian's emergency contact information readily available and knowing the location of the nearest emergency animal hospital can save precious minutes that may determine the outcome for both mother and kittens. The landscape of feline birthing education is rapidly evolving. Traditional educational materials like infographics and timelines have served as the foundation for cat owner knowledge. However, demand for educational content on cat birthing is increasing dramatically. Pet ownership has surged, and new cat owners are seeking more comprehensive, accessible learning resources. The future of feline birthing education lies in interactive learning experiences. We can expect to see immersive 360-degree videos that allow viewers to observe the birthing process from multiple angles. Artificial intelligence is revolutionizing educational tools. AI-assisted applications will help cat owners identify normal birthing signs versus concerning symptoms that require immediate veterinary attention. Perhaps most exciting is the development of portable ultrasound devices for home monitoring. These consumer-accessible tools will allow cat owners to monitor their pet's pregnancy progress safely at home. These technological advances will complement improved neonatal care facilities. Modern incubators and monitoring systems are already enhancing kitten survival rates significantly. Despite all these technological advances, the fundamental principles remain unchanged. Preparation, careful observation, and knowing when to seek professional veterinary help are still the keys to a successful and safe birthing experience for your cat.